Welcome everyone again to the Agency Systems and Community Health Improvement webinar on state tribal collaboration, finding synergistic partners prepare for accreditation with Laura Sonny Spencer from the Cherokee Nation and Terry Klein from the Oklahoma State Department of Health. In an hour, Laura and Terry will share their lessons learned and tips for partnering with other health departments to prepare for accreditation and beyond. In addition, we'll gain some insight into how Cherokee Nation works and its development of a tribal public health system, the challenges, health practices, and benefits to share before we go into the session that we'll discuss these. So before turning it over to Laura, I want to provide some information on Laura and Terry. Laura is the manager of public health projects. She's a performance improvement manager as well as an accreditation coordinator for Cherokee Nation. We'll hear more about Cherokee Nation during her presentation. She is promoting and facilitating the expansion and improvement of Cherokee Nation's tribal public health system while ensuring that performance improvement and quality improvement is implemented into these public health improvement efforts. Some of her immediate tasks are, of course, preparing the tribal public health system to apply for accreditation through the Public Health Accreditation Board. Laura is proud and grateful to be working for her tribe and people. And Terry Klein is serving in the dual position of Oklahoma Secretary of Health and Human Services and Commissioner of the Oklahoma State Department of Health. He served in various leadership positions under several governors of Oklahoma. And with that, Laura, I will pass it to you.
That sounds good. Thank you. Good afternoon, everyone. I'll go and proceed, and hopefully we can shed a little bit of insight and provide some tidbits of information about state tribal collaboration. So, and before I start, I would like to note that this presentation contains, my slides contain a little bit more verbiage and info on my slides than I normally have on presentations that typically. But this is a webinar. I wanted to provide this information so people who can attend and those who could not attend could access these later and have this information available to use as a resource if needed. And I'd also like to stipulate that this is also a presentation from the perspective of PIM, a Performance Improvement Manager and Accreditation Coordinator. Cherokee Nation has great relationships with the state of Oklahoma in various health and non-health efforts, but these I focus on my experiences as the Accreditation Coordinator and Performance Improvement Manager. So I just wanted to make that little note. I tried to mention some of the other non-accreditation efforts, but again, most will be around what I've had my hands on, and of course is accreditation and performance improvement. This presentation, what I'm and tribal public health system, and current collaborations between Cherokee Nation and the Oklahoma State Health Department. Example of a collaboration, or a recent collaboration between Cherokee Nation and the Oklahoma State Health Department pertaining to accreditation, and then lessons learned, ideas generated on how to strengthen these tribal relationships and collaborations, and just some suggestions for promoting future collaborations and how that can be beneficial to both state and tribes for accreditation purposes and beyond. So just briefly to give you a good idea of Cherokee Nation, we are come to 14 counties in the northeastern part of Oklahoma. Counties fall wholly within Cherokee Nation jurisdiction, and then 18 counties fall partially within Cherokee Nation's jurisdiction. So it does prove to provide a little bit of issues sometimes when you're working at cross-jurisdictional areas, boundaries, and those types. So definitely there is a need for relationships and communication going with the state, but with our local health departments and local entities, groups around, because in our counties, it's zigzag-ish boundaries, and so really, again, have to do that communication to assure, what is Cherokee Nation tribal land and then on-tribal land. We have a tribal jurisdictional area. When you hear me say that, usually I'll say TJA, TA, tribal jurisdictional area. I'm sorry, TJA, but the term is tribal jurisdictional service area, and that again refers to just the tribal land that is specifically Cherokee Nation tribal land. And that's 9,200 square miles. And just again to give you kind of an idea of Cherokee Nation, we're 51% rural, again, versus 32% for state. So we do have a lot of rural areas. We do have some populated areas, but for the most part, the majority of Cherokee Nation is a rural area. And the capital is Tahlequah. This is a picture here of our complex there, our headquarters. So, and just some demographics needs to kind of see again what here at Cherokee Nation, what we are working with. We're the second largest tribe. The Navajo Nation is the largest tribe in the U.S. And so I wanted to just give you guys a feel of the population that we're working with. The national population is over 300,000 registered tribal members, and then Oklahoma population is just over 200,000. And when we look at the 14 county, again, when I say 14 county, it's looking at the whole entire county, and that's roughly 160+ thousand tribal members. And then when you look at our tribal jurisdictional area, the land itself, they're about 140,000. Although in a moment you'll see that those numbers, although those are just recent numbers, there is some is that we still got to work out in as a tribe. This is information that has been taken from our registration department. However, we do see that there is some discrepancies there for various factors and reasons. Deaths, those memberships may have been pulled out, people who move to new areas within our tribal jurisdictional area as well as without. So we'll see in a minute that there is some discrepancies, but these are the numbers that we're working with, and we are aware of that, and so there's some things that we need to improve in the future. Again, if you take a look at our population, again, consider the entire 14 counties, you're looking at a population of, just over 1 million. So technically, our efforts could potentially affect up to, over 1 million people. The total population of American Indian and Alaska Natives is, over 200,000, and then when you look at the total population, and 166,000. And I hope you guys see the difference here. When we talk about our tribal jurisdictional area, that's taking out, only considering our tribal lands, then that dramatically drops down to all races, 500,000. And one of the biggest factors in that is Tulsa County. Tulsa County is a huge county. In Cherokee Nation, the land of Cherokee Nation really is just a very small portion of Tulsa County. So that's why we have to make that distinction, because it is a huge change when you're looking at population numbers. So, and as well as American Indian, Alaska Native numbers goes down to 125,000, and then total population again 139,000. And like I said, that doesn't make sense when you look at the American Indian, Alaska Native, but right now that's what we have on record, and we do realize that we need to do again to improve that process so that we can get a more accurate number of our tribal members. But hopefully you can get somewhat of a picture of the types of population that we're looking at, and that we can potentially impact, influence, affect. So on to all services, our tribal public health system. We're really at a stage right now of trying to figure out our tribal public health system. A lot of health departments are restructuring, but for us, we never had anything in place. So for us, we're building it from the ground up. So this little diagram is really just an in works. It's a really fluid, it'll probably change, But you guys have probably seen the jelly bean diagram before with the public health system. Well, this one is something that, again, is going to be in the development, and we're trying to figure out exactly who is our, in our public health division. It's a lot easier to identify who our clinical health is, because we have our facilities and, our hospital and clinics. So look for this to be changed, but we do want to clearly define ourselves, not only for ourselves, but for our partners and for everybody else, because you can't really understand where you're going unless you understand who you are, type of thing. So I take a closer look really quickly at the health division of how it's turning out to be and the clinical health side. So our clinical health division services, 100,000 plus patients. We've 8 tribal health clinics, 1 employee clinic, 1 tribal hospital, and then 1 Indian Health Service hospital. So we manage, we take care, we run all of the clinics and hospitals except for the Indian Hospital in Claymore, which is still governed or managed by the Indian Health Service, HHS. So just to give you kind of a visual of what area. With Health Division, I listed some, but again, it's not definite yet. We're still trying to figure out all the pieces, who needs to be at this table for the core components of our public health system, but this is looking like who some key players are going to be. And look for, again, for us to continuously figure out and define ourselves to make a sustainable tribal public health system for now, for in the future. So, and it is worthy to know also that our public health division has counterparts at all our clinics and hospitals. So, looking at some of our efforts that we are completing or have completed, a lot through the NIFI funding, and again, we do have other initiatives and other efforts, but remember, this is from the lenses of their accreditation coordinator and performance improvement manager. But these are some of the major efforts that we're working on. Of course, PHAB accreditation, conducted our self-assessment, tribal health assessment, tribal health improvement plan. You'll see that, the CHA, we've changed some of those to fit more accurately with a tribe, developed our strategic plan, and eventually out of those, we're going to deliver a State of the Nation health report similar to those that are released by the Oklahoma State Health Department. We do look at those documents as a guide for us. Then we also want to will distributing community health profiles as well. We've implemented digital storytelling as a major part to kind of not only for our to something that's traditional as our Cherokee traditional oral storytelling, but it's also a great tool for us to use, get our information out there in a new way, and it's always been very successful for our use of digital storytelling. And we see that there is a major need, a critical need at Cherokee Nation for a data epidemiology division, and so that's some of the things that we want to do in the future. Performance management system, again, we look up to the Oklahoma State Health Department because they have an excellent performance management system, and we've communicated with them on several occasions talking about that system. And then developing a tribal public health code and a tribal roadmap for PHAB accreditation. And you guys are getting it first. We haven't made an official announcement. We just recently developed a tribal public health website. It's CherokeePublicHealth.org. We'll have a major announcement in newspapers and national, like Native American Times, in the next couple of weeks. But we do have a new Cherokee Public Health website that all of our information will be put and broadcasted for everybody's use. And so, again, going through their accreditation, it's again to let people out there know what we've already accomplished, and so that way, hopefully, if you have questions at the end, be glad to take that. Use of the MAP framework, and Oklahoma State Health Department also has used this, and I'll touch on some of the efforts and how we've come together, helped each other out with that in just a moment. We've established a public health committee. Again, as I said before, we've done a self-assessment. We've developed our tribal health assessment. Then the health improvement plan and the strategic plan has just been recently, and I kind of put some timelines in there so you can kind of see we started this initiative in February 2011, and the strategic plans and the improvement plans have just now, in the past few weeks ago, have been accomplished. So you can kind of see the timeline that it took us to do that. I won't go through this because it's exactly what I just said. It's a visual, again, to refer back to after, if you want to print this out afterwards or refer back to this. So we are applying for accreditation in 2013. I foresee us within at least within the next 6 months. We've got everything, lined up, our ducks in a row for us to apply very soon. We already submitted our statement of intent. PHAB has already accepted our statement of intent. We filed out our 3 prerequisites completed, and we're in the documentation selection process right now. So we will be applying in the short future. So you guys kind of see how where Cherokee Nation is on this for the progression that we are at. Just to kind of mention some of the past and current collaborations that Cherokee Nation has had with the Oklahoma State Health Department. The key things that has really been great for us is the state of Oklahoma has a tribal liaison, Sally Carter, and she has really been a key player in keeping the communication lines open and somebody that we can go to and can then get us to the right people with the state. Turning Point is another thing, another initiative that has been very successful as with our collaborations. Turning Point is representatives throughout Oklahoma and the counties, and so since the Oklahoma State Health Department geographically, physically, is about 3 hours away, I'd say, from Tahlequah, sometimes that physical distance can hinder us being as active as we could be, because that is quite a distance. But we often make our communications and our collaborations together locally, like with our local health departments and Turning Point. And there's been several occasions with Turning Point where we go to each other's trainings. We have somebody come over and talk to us. At one time, they had regional Turning Point district meeting, where all of the regional Turning Point representatives came together. I presented a tribal perspective on our tribal health assessment, and again, they took the time to listen and get tribal perspective on a variety of efforts that they're doing. So it's really a great way to be able to lean on and ask for and receive information from the people that are locally here within our area. And again, includes local health departments. We work closely with a few health departments that reside within Cherokee Nation, and that's kind of how we keep up with what's happening at the state in Oklahoma City. Also had great efforts and accomplishments with the Oklahoma Tobacco Settlement Endowment Trust, with Oklahoma Tobacco Helpline, Communities of Excellence in Tobacco Control, and allow us to address specific populations of our tribe of American Indians and Cherokee specific, making wonderful and beautiful campaigns of visuals of billboards and whatnot. And then another successful thing that the state has collaborated with us is 7th Generation Tobacco Conference. And originally, the title is Tobacco Conference, but in the past couple of years, it has really morphed into more than just tobacco. And the people that help this is not only, it's the state health department, but also a variety of tribes within Oklahoma. So it really brings all of the tribes of Oklahoma, or a lot of tribes in Oklahoma, and then the state health department, local health departments come together. And like I said before, we branched out to other public health and prevention efforts. We've had, farm to school walking school buses. We've built environments, so it's really turned into more of a public health prevention type of conference. There's been some great success with the help of the state and our local partners, local health departments. We've had efforts on data. There is still much more work to be done with data and sharing and communications, but the State Department has always been very helpful because, like I said, we don't have an epidemiology center or division, so we really rely on the State Health Department to help us with that data. Eventually, one day, we would love to be able to collect that ourselves and make that contribution to the state and share. But right, we really for the help of the State Health Department on some of these data. I won't go through every single one of them, but there is some data that we cannot get if it was not for the state, and so they've always been very open and available for our help so that we can reach out to them. There are various surveys that Cherokee Nation and the State Health Department have collaborated with, BURFIS, the Youth Tobacco Survey. Cherokee Nation here has a cancer registry, and we've always, we've collaborated greatly with the State Health Department and university partners, the University of Oklahoma College of Public Health. And, so we've had great success in building a cancer coalition, again, with state help, and we have great efforts, campaigns going out because of this cancer coalition. So, and specifically with the efforts of the Tribal Health Assessment, Dr. Dave Gann, who's our surveillance coordinator, we call him the one-man show because right now he really is the only one here, at least with our tribal public health system, who is doing the surveillance part. And so you imagine one person for 14 counties for an entire tribe. It's very daunting. But again, he wanted me to stress that he's had great help when he's reached out to the State Health Department. They helped us in various ways. He was able to present to Oklahoma State Health Department our tribal health assessment once we finally got the final draft, and was able to get some feedback from the Oklahoma State Health Department, and so we could look at what we had and again, to make it the best possible report that it could possibly be. And so we had the people of that with expertise in that area help in again getting feedback for our tribal health assessment. Also with collecting the data from various departments, Dave has been able to establish relationships so that again he can call upon them to help whenever that need arises for specific types of data. And I mentioned the Oklahoma Violent Death Reporting System was one that he was able to access and get some data from that. Then the Public Health Lab for the services that they offer for PHAB accreditation purposes. Again, since we're only we're a tribe, we don't have everything set in place to be able to handle certain, like outbreaks and whatnot. So we've been in contact with the Oklahoma State Health Department in order to figure out exactly what the process would be. I know there's MOUs, being generated because of that, and there is some already on file, but there's certain services that Cherokee Nation is not yet capable to provide, and again, that's when we would back on to the Oklahoma State Health Department and refer back to them. And again, they've been very helpful in being able to help us with that collaboration. Now, for accreditation efforts, one of the examples that I wanted to note is that I'd say about a month or a month and a half ago, Julie, is the Oklahoma State Health Department's accreditation coordinator. I forget her official title, but she's deep in the accreditation efforts, as I'm sure everybody has heard that the state of Oklahoma, or Oklahoma Health Department, received accreditation. Well, about a month and a half ago, they hosted a training session for the local health departments of the accreditation coordinators for the local health departments within Oklahoma. And it so happened that we heard about it. contacted Joyce to see if there was a way for us to come up, and she was, welcomed us up, and it was a really great experience because not only did we get that training, but we also got to see a little bit of the inside of how the Oklahoma State Health Department works. Faces, we got to see the faces of, who works where and that type of thing. So it was a great networking experience, but we also got to meet people the accreditation coordinators that work within our tribal jurisdictional area. And so we exchanged information, and there's some communications going on between us because we are servicing the same area. So we may have some information that they can use and vice versa. So again, it was a great way for us to be able to start making those initial contacts. And originally, it was supposed to be something just, internal meeting for local health departments, but because they went ahead and up that invitation to us as a tribe, even though, again, we're an outsider, we were able to come in and learn about some of the things we probably, wouldn't be able to understand unless we were there and seeing the process and the workflow and how everything runs. So,
the director of the Oklahoma State Department.
Oh, I thought somebody else should. And so we got to see some examples of documentation from both the local health departments and Oklahoma State Health Departments. So, and it was a great resource that we have come to find. For Comanche County, we made some contacts because Cherokee Nation had something we needed to work on, as in developing like a public health career development plan. And so it so happened at this training, the Comanche County, one of the examples that we were looking at, it was something exactly to that effect. And so we started talking. Contact information was transferred, and so now we have a source to go to kind of help us as we develop our own plan for developing, public health workers within our tribal public health system. So we would have never known these names. We would have never known that these documents existed if it wasn't for welcomeness of the Oklahoma State Health Department to allow us to come into this otherwise internal meeting. But and so I thought that was an excellent example of collaboration because, again, we offered our resources and our information to people as well. Please, if I'm going over time, just interrupt me. I just have a few more slides, actually. So strengthening the state-tribe relationships and promote collaborations. The suggestions, just thinking about this, was to really have the state or local health department reach out to local tribes. I say this because a lot of us are in the infancy of developing a tribal public health system. Not many, if any, tribes out there have a public health department or system fully developed. Most of us are, most of the tribes are kind of going to be like us, where we're just developing from scratch, blank canvas. We're developing from the beginning a public health system. So we not have at first for the state and local health departments to reach out and to help out a little bit more in helping us figure out exactly, public health, prevention, the infrastructure, that type of thing. But I'm sure eventually, then once we get up to speed, that then begin making those initiatives. But that's kind of my suggestion for now. In a couple of years, my hope is that I will be saying 2 years ago I said that tribes, did not have that development met, but now we do. So I envision that. But as for now, I think that because, again, tribes are used to using the Indian Health Service for primary care than prevention, that a lot of the infrastructure is not built yet. There may be pieces, and so that's why I just encourage the state and local health departments to make those initial attempts of contact. and so I know that's one of our goals here at Cherokee Nation, as we are sometimes at this point a little bit far ahead other tribes. Our goal is to reach out to other tribes as well, and to start paving that way for them and help educate and informing. We encourage state and local health departments to do that as well. And invite tribes to meetings and trainings that might be considered internal, and vice versa, because that's something that me and my coworkers, my peers here at the tribe have said, that, you know, we learned such a great deal of the process and the infrastructure of the health department just in that one training there. And so I can imagine, you know, if we invite them into some of our internal meetings, that I think that can shed some light into state health department people as well. So I encourage that, because again, it really lets people who are not insiders within your health department to get a better understanding of how things work, as well as, again, meeting people and getting to understand the organizational flow of things. Central system, a tool for data sharing. And we all have, with our own entities, our own organizations, tools for doing this. But I think in the future, I hope all of us considering sharing with one another. And so I say this for tribes with the state, tribes with our local health departments, that may possibly in the future that make communications a lot easier if we have some type of data sharing information site where we can quickly turn to in order to get some general overview facts and information and data. And one of my other suggestions is providing tribes an avenue to have a voice. And I say this because the state health department welcomed us into their site visit as a partner, and the Cherokee Nation was one of the tribes that sought to provide information to the PHAB accreditation board upon the Oklahoma State Health Department site visit about our partnerships and collaborations. And during this time, it discussed how the Tulsa City County Health Department, Oklahoma City County Health Department, and State Health Department have just begun to have this quarterly, I'm not for sure exactly how often, but I think it was quarterly meeting together and to go over, public health efforts of the state. And because of that, the idea generated that, we need some some tribal representation on there. And so Kevin Meeks, the Oklahoma City area office area director, we had a conversation after that site visit amongst a few of the tribes there, and thought that would be a great idea to develop a public health committee, but statewide, that had a representative from each of the tribes, and from that tribal health committee, choose a person or two to sit on that meeting that commences with the Oklahoma State Health Department, the Tulsa City County Health Department, Oklahoma City County Health Department. I never known that, again, if it wasn't for the invitation from the State Health Department. So I think in closing, again, just some last-minute thoughts about how the benefits of state-tribal collaborations can help is that it's really neighbors helping neighbors, and, it gets that mentality going and that environment developed of neighbors helping neighbors, because really exactly that's what we are, tribes and state, local health departments. We're just neighbors living in the same area and wanting the same things that everybody else does. Again, more efficient use of resources for both sides. The tribes have resources, and we want to work together and use those resources to benefit the people that we serve, because the people that we serve are the same people that the state of Oklahoma are serving. And again, we'll be able to reach a larger population. Ultimately, it's going to strengthen the ability to improve health and well-being of all of our people, because again, we work for the same people. The state works for Oklahoma people, so do we. And as before, in the population, we do not exclusively, we do not exclude anybody in our efforts. As you guys know, public health and prevention efforts affect the environment, affect everybody. So our efforts and our projects and our programs affect everybody, all races, all people, within our 14 counties. So thank you, and I hope you guys will be able to get a little tidbit of information from that. Thank you.
Thank you, Laura, and I'll turn it right over to Terry now.
This is Terry Klein, and let me start by thanking Liliana for hosting us today. That's fantastic. I appreciate that. And Laura, thank you for the presentation as well as the partnership with the Cherokee Nation. As I find my way down or looking for my controller, so let me just find that briefly. Liliana, I may need you to just kind of walk me through that.
No problem.
Can I get you to just hit the buttons as we go?
I can.
Okay, so we'll go on to the next one. And so I'm going to follow the same format that Laura had in place. This is the background for the Oklahoma State Department of Health and a little bit of the demographics for Oklahoma. Department, we have 89 sites, 68 county health departments. Tulsa and Oklahoma City are actually autonomous from us. If we go to the next slide, we have, this is just tribal jurisdictions, 38 federally recognized tribes in the state of Oklahoma alone, with over 480,000 American Indian Alaskan Natives, according to the 2010 census. If we go to the next slide, part of that system is very, very complex, where we have autonomous, independent tribal sovereign nations spread across the entire state. Of course, you heard a little bit more about that from the Cherokee Nation. If we go to the next slide, you will see that we have a lot of challenges in our state. And of course, our belief is that we can only make improvements in these areas if we form strategic partnerships that are located throughout the state. So we're 43rd this year. 3 years ago, we were ranked 49th in the country according to the United Health Foundation. Some changes that are ever like the obesity rates, very high smoking rates that have us at 47th in the country in terms of prevalence rates. The next slide. We believe that we need to mobilize those communities, really leverage resources, recognizing that everyone's funding is limited and resources in terms of time and energy. We really cannot afford duplication. One of the efforts, if you go to the next slide, and you just referenced from Laura, the infrastructure that we have for our Turning Point community partnerships. We have 70 of these partnerships, which are really about grassroots, so local solutions to local challenges. And we provide some structure and support to sometimes technical assistance, other things like that, to help with these grassroots, but they really are driven at the local level. And it's really capitalizing on resources there. There have been literally millions of dollars that have been leveraged either in in-kind services or in actual funding at the local level. Again, independent of the health department, but supported through us. For the next slide, you'll see that we have one initiative. It's called Shape Your Future. It's a big campaign we have to improve health outcomes. One example of many, really with the mantra to eat better, move more, be tobacco free. You can go to the website and pull up ideas and programs for doing things to improve your health at the individual level, at the school level, at the community level, at the business level. If you go to the next slide, as part of that program, we have the Certified Healthy Oklahoma program. Just recently, an event where we recognized this year's awardees. So these are spread throughout the entire population. We had several tribal nations that have certified healthy organizations within the tribal structure. And right now, overall, just with this last batch, we had 349 certified healthy businesses, 114 certified healthy schools, 52 certified healthy communities. So altogether, from years past, we have over 2,000 certified healthy Oklahoma programs. You know, it was about driving change at the local level, completely voluntary program. For some of these categories, once you're certified, then you're eligible to apply for incentive grants through the Tobacco Settlement Endowment Trust, which you heard reference from Laura earlier, which has been a great partner in improving health outcomes in the state. If you go to the slide, this is really here just as an example, something for back to if you're interested. We have so many different initiatives and we have so many different strategic priorities. We really needed a document to kind of pull it all together. And this is the performance management model developed by Joyce Marshall, who is really our guru around performance improvement, as well as helping to be charged for accreditation at the state level. And this really provides a roadmap all the way from the individual all the way up to the national goals and objectives, and what are we doing to contribute to those. You will see that one of the goals on the left-hand bar under national is accreditation.
Oh, nice.
That was part of our one of our strategic priorities because we believe that's fundamental to improved effectiveness, health department. So it made sense for us to focus on that as a goal. If you go to the next one, you'll see that we have some initial steps, and this is more around our partnership with the Cherokee Nation. And I'll have some more concrete examples for you, a lot of examples. We didn't just start the work of partnership around accreditation. There was an established track record prior to that. And that'd be, one of the messages I would send. We really start those partnerships, reach out. If you work within a local or state government, reach out to your tribal nations. They are an incredible resource. And our experience in Oklahoma has been that they're also fantastic partners. If you go next, part of that, as Laura mentioned, it really is two-way communication and two-way opportunities. Cherokee Nation specifically has invited members of the health department here, the state health department, to call events in Tahlequah, and has invited government officials to a big kind of celebration that takes place with parade and cultural exposure and opportunities to learn the history and understanding of increased appreciation for not just the challenges that the Cherokee Nation faces, but how they've overcome those and are in a position of great strength. Really positioned us well to work together around accreditation and to share some of those initiatives. Part of that included the beginning of this white paper and draft standards, getting that kind of feedback and working on that together. There's no reason we shouldn't all benefit from those initiatives. Go to the next slide. Again, a snapshot of some of the work that we've done together. You can see from the WIC example, we actually shared food card where we are in agreement, where we, with several nations in the health department, agreed to really put out one card. So there's some consistency across state and less confusion for participants as well as people who are vendors in the program. If you go to the next slide, this one example of a great partnership between the health department and several tribal nations, as we had initially imported advertising from other states just as a way to kind of minimize our cost and be more efficient. We got pretty immediate feedback. Well, wait a minute. The tribes that you're representing actually are not tribal people within the state of Oklahoma. So we're to look closely at the three posters that are examples. You'll see we've actually listed tribal members, Cherokee Nation, the Potawatomi Nation, and the Choctaw Nation. And it's important to really tailor the messaging specifically to tribal nations if we have any hope of seeing that improvement and really seeing those efforts pay off. So it was important to be able to do that. In Oklahoma, around accreditation, you can see that when the test sites, Oklahoma, there were 30 beta test sites across the country. If you go to the next slide, you'll see that Oklahoma was one of three, the only state in the nation that had beta test sites at all three levels of government. That would be the local level, the local level, and the state level. So that gave us an opportunity through those beta test sites to work together. Next slide, you can see that we had some key strategies that we thought were important to move us along in accreditation. We have, again, examples of working together, a core group of people who will share their responsibilities and take leadership roles in advancing the domains, the 12 domains of accreditation. You go to the next slide. These are the 3 prerequisites that are required of every health department that's applying for accreditation, from the assessment to the health improvement plan and the strategic plan. 3 of those elements were in place and are in place before you apply for accreditation. And again, working with tribal nations, absolutely critical in having robust assessment and health improvement plans. Go to the next slide. Quality improvement is interwoven throughout. Although one domain, domain 9, that's specifically focused on quality improvement, it really touches absolutely everything in accreditation. Next slide. These are some of the lessons learned. Our belief is at the health department is that collaboration is actually critical to our success. It's important to have that documentation. You can have great things going on, but if they're not documented, it doesn't count. And sometimes that's a bit of a challenge, so that it's important to start that process immediately. The next slide. Next one. We have these meetings jointly with the tribes and other local entities, and you can't really, time-wise, can't afford to have 150 different meetings across the state. You really want to provide those opportunities for learning from each other and working together to make sure that we're in alignment and look to one another, really to make sure that we understand each other's perspectives, and it's an ongoing learning process. Next slide. The continuation, really a learning process, as you heard from Laura. Data and the context of all of that is really, really important. We see incredible differences across our state and a lot of variability, and it's important to recognize that when we're looking at interventions and what we need to do to move forward. And if you go to the next slide, we have consider it to be a great success in terms of making our products that we deliver stronger and more effective. All of that work has paid off. We were just conferred accreditation from PHAB, so we're very pleased with that, and it has included an incredible amount of energy in the health department, and also we've received notes from people all across the country. So I think it's a great time in public health to really move the public health accreditation agenda forward. If you go to the slide, we think that accreditation is important for all of these various reasons. It really provides that standard of excellence, get credibility as a health department. People who don't understand the language of health department, they do understand what accreditation stands for. Hospitals have it, jails have it, higher institutions of higher education have it, a lot of other entities. You go to the next slide. It's about its challenges, and good communication is critical to that. It's not always easy, as you heard. Sometimes there are geographic barriers, sometimes there are cultural barriers. We need to make sure that we are committed to partnership to overcome those obstacles and those challenges. Next slide. Lessons learned. To be successful, we need to really understand the tribal politics, understand the diversity across tribes and within tribes as well. As you see in that last bullet, there is a lot of diversity in terms of how Native American communities are represented very, very differently, sometimes within the same geographic area. The next slide, actually this is getting close to the end. The great lesson learned really is the importance of humility and understanding very, very clearly we have a lot to learn. Important to have those partnerships to be able to learn from others. Next slide. Helpful practices, just in terms of having tribal consultations. Most of our growth is really about relationships and demonstrating respect for our elders and tribal leaders, and really recognizing that it takes time and experience and many opportunities to develop those relationships, and very important to keep our promises as always and only promise what we can deliver. And the last is we believe there are great opportunities to leverage mutual resources. We're stronger together than we are apart or individuals. Overall objective, of course, is to improve public health, and we can only be successful if we work partnerships. And I will close just by saying how much I appreciate and am honored to work with the nation. And with that, I'll close.
Thank you so much, Terry and Laura, for sharing your great story of collaboration and partnership. I'd like to turn it over to everybody else to provide any comments, questions, and I'll take those verbally or written. Do you have any questions?
I several people from the Cheyenne Nation.
Great, welcome.
They have a Montana division and an Oklahoma division. People from both of those. Those Mennonites were very big, and Mennonite wrote the first Cheyenne English dictionary.
Oh, really?
Question for anyone on the call? All right, I'll move to another question that came in. Is someone at the State Health Department who serves as a primary point of contact with tribes, or how does that work?
Yes, there is. Thank you for that question. And Laura had mentioned her name, so let me repeat that. Sally Carter is the tribal liaison for the department. She can provide that single point of contact. We make it very clear, and Sally certainly makes it clear too, she is not the sole representative of that partnership between the health department and tribes. She really helps to steer people in the right direction. I don't have her number in front of me, but you can call 405-271-4200, 405-271-4200. That's the main number, and they'll connect you with Sally. She's an incredible resource here in Oklahoma.
Great, thanks. And I guess likewise, do you, Laura, at your department, is there a specific person that's been the contact?
I really don't believe so now. For the health side, now Cherokee Nation may have someone that, again, I'm not aware of that, but all of us here, again, that shows the welcoming. We are able to contact the state, individually, the administrator-wise, people at that level feel confident and assured that we're able to reach out and contact people. So at the Health Services Department, there's not one particular person. There may be somebody for Cherokee Nation as a whole, but not for Health Services.
All developed a memorandum of understanding for the work you do together? Is that kind of an ongoing thing? Do you have anything documented around the work that you do together? What would you recommend around that?
So this is Terry, just to jump in quickly. We do have a tribal consultation policy, which is really a formal arrangement because it's between the Oklahoma Department of Health and a sovereign nation, and we take that responsibility in those respective roles very, very seriously. And then we also have just numerous individual contacts, as Laura was saying about, those examples that were on my slides of individual departments that are working with other departments within the Cherokee Nation. And there are some, as also mentioned by Laura, some MOUs that are being developed. So it's clear to the Public Health Accreditation Board there are more formalized relationships in place, too, for some of those kind of shared responsibilities.
Mm-hmm. Well, if there's another come in the meantime, I will be checking, but now I wanted to share a resource that ASTO, the Association for State and Territorial Organizations, has on their website, and it's Knowing State Public Health and Knowing a Tribal Health primer. And I think you can see on my screen here, it's a very short, readable document, about 4 pages or so, talk about the role of the state health official or the tribal health leader, and tips on how to create successful partnerships between them. I will include that in resources from this. And if there aren't any more questions.
Yeah. I'm sorry. I do notice on my screen that Bruce Ringer, I don't know if I said that last name right, has asked, can you explain the symbolism of the title 7th Generation Tobacco Conference? So quickly, I'll just say that the 7th generation was developed in mind for the future. Literally, as it says, 7th generation, that the efforts and projects and that we're working on now, we want to affect within 7th generations from now. So that's kind of where that 7th Generation Tobacco Conference came from, is that we want to work towards providing for the future.
Great, Laura. If you could just fill out the evaluation for us, this always helps us improve webinars and understand what topics you'd like to cover. So if you could please complete that evaluation, we would greatly appreciate that. And most of all, I'd like to thank Laura and Terry for all your work that you've done together and for highlighting it and sharing it with us. Thank everyone for participating, and let us know if you have any additional questions, and we can include that in the recording.
Thank you.
Thank you.
Bye. Bye-bye.
Bye-bye.